Overweight and obesity in children has reached epidemic proportions in Barbados and the region. The Caribbean Public Health Agency forecasts that 1 in 5 children are at risk of developing a non-communicable disease or NCD later in life. 1 in 3 children is overweight or obese. The Barbados Childhood Obesity Prevention Plan 2015 to 2018 was developed to decrease the prevalence of obesity in children and the youth. Dr. Kelvin Phillips is the Senior Medical Officer of Health, NCDs, in the Ministry of Health and Wellness.
Childhood obesity is an important issue. A significant proportion of our school-aged population are overweight or obese. And what we understand about obesity in later life and about risk for NCDs is that individuals, and recent work is suggesting particularly between the ages of 2 and 6, individuals who are obese between the ages of 2 and 6 are significantly more likely to be obese into adolescence, and if they're obese into adolescence, a lot more likely to be obese as adults. And obesity is a very significant risk factor for non-communicable diseases like hypertension, diabetes, and their complications like stroke and heart attacks. So addressing obesity in children needs to be an important thing that we look at and that we seek to address in seeking to address NCDs more generally.
One agency which is working with the ministry to address childhood obesity is the Heart and Stroke Foundation, which operates the Yute Gym. It was established to assist young people between 8 and 19 years old in preventing NCDs.
Presently, we have 70 active participants and 10 referrals waiting evaluation. They have a history of overweight or obesity, and they're referred by pediatricians, general practitioners, schools, professionals in healthcare settings. So this is how one is referred to the Yute Gym. To give a small background, a little historical perspective, this Yute Gym was formed about 3 years ago, and it started as infancy, small beginnings, through the fact that there were a number of patients being referred to the Queen Elizabeth Hospital, and I was on staff. I just recently retired from QEH, but our clinic was getting larger and larger. And whereas we had a dietitian on staff, we also had a doctor to look after the children. We didn't have the other resources which are necessary, mainly the activity program that we could refer. So this was started with the kindness of the Heart and Stroke Foundation directors. They agreed that we would be able to form a Yute Gym. And it started with a few children, and it has gradually mushroomed now to almost capacity.
Daniel Allman was referred to the Yute Gym when he was 17 by a nurse who was concerned about his weight. At that time, he weighed 242 pounds.
I never missed a day at the gym, and I'm early almost every time. It changed my life that now if I miss a day in the gym or I get to the gym too late, I get very upset, yeah. And the gym has brought a lot of opportunities for me.
She referred me to the Heart and Stroke Gym, which is near my home and inexpensive. I now assist the gym instructors and I try to motivate other young people to address overweight. Together, we are meeting the challenge of obesity in our community.
It wasn't easy to lose weight because it had many days where I was feeling down, you know, and like, it's always a mind thing because working out in the morning isn't an easy thing because sometimes you be too tired, so sometimes you always have to give yourself the extra push even though you're not wanting to do it, but you still do it. And working out at night when you come from school or whatever the case may be, you'll be tired too, so you still have to give yourself the extra push. So it's discipline and other things that help you to manage weight loss. Before, my eating was very bad, but now it changed to an extent that sometimes where I go to eat, sometimes I don't feel like eating, or some things I used to eat before I can't eat the whole thing, or stuff like that.
All right, and start. Let me go.
So we're here at the Yute Gym, and I'm so happy I was able to grab a couple of the parents to talk to me about their journey and also their children's journey as they work on becoming even more healthy, because we're not saying that they're unhealthy now, but just one thing turning up as something as a risk factor being a little bit overweight. So I just wanted to talk to them today about their journey. In terms of your journey, how did you hear about the Yute Gym? And tell me about your son, daughter, and her journey.
I heard about Youth Gym through our pediatrician. So she was a little concerned about Abiola's weight, and she thought, her getting more active would have been something that would have been useful. And she actually suggested this as a resource.
And what was your take on that? Did you immediately say yes, or was it like, I don't know?
I was a little hesitant at first, but then I came and I thought the children were having a good time, and I was appreciative of that.
I heard about the Youth Gym from my son, pediatrician, Dr. Sean Bullen. He was kind of concerned with his weight, and he suggested the Heart and Stroke Foundation. Actually, it's not the first time that I was given a letter to come here to join him in the program. I blame myself a bit because I just put the letter there and just don't bother about it, because I figured, it was kind of, I was thinking about the heart and the stroke and so on, so it's kind of weird in a way, yeah. But then when he went back again, he gave me another letter, and I bought it there, and he was joined from then.
How's it been going for him?
Well, he is more excited than me. We used to have to get here for 8 o'clock, and he's actually wake up long before the time. That is actually a day he's actually get up early, and he's really excited in coming to the gym. He likes to be on the machine, and he really likes it a lot. He really do. He's very excited.
My son, Darren, well, he was recommended to the Heart Stroke Foundation through his dietitian from the clinic. So we brought him down because he has problems with being Down syndrome and stuff. Those kids kind of tend to put on weight a lot. So we brought him down, and from day one, I think he took a liking to it, because, like myself, I used to exercise a lot, but not as much as I used to before. So he took a liking to it from the beginning and moved from strength to strength from there. He likes it. He's excited about it. Every Saturday morning he looks forward to coming. And I found it to be a bit ironic for me, because as some people might figure, if you're coming here, you got issues with your heart and whatnot, but no, he doesn't have that sort of issues, just weight. But for me, well, what I found it ironic was a couple of months ago, I myself was having some serious headaches and couldn't figure out what was really going on. I was lagging actually, but eventually went to the doctor, and my pressure was really high. I mean, extremely high. So I was on medication, still on it, but kind of ease off a bit. So I had to change up some stuff, food-wise, and hit back the exercise. So with Darren, me and him can exercise, or we do exercise at home and stuff, so it's working out fine. He is on a diet program as well, cutting out certain foods, sugars, starches, all those calorie stuffs, right? Try to get him off of that, and then these sweet drinks as well, more water-based drinks and stuff like that. And exercise, try to get him in, not just here, but during the week, his mom would take him walking, stuff like that. So working out pretty good. Same thing goes for me. I start by exercising.
My mom is a diabetic too, and I being an auxiliary nurse, I did a lot of research in terms of children and diabetes and so on, and I didn't want that for him. So I tried very hard to include certain foods at home. I know you can't cut out the snacks, because when they're at school, they will get tempted and they will use certain things, but he doesn't use any junk food or anything like that at home and so on. Yeah. But he drinks a lot of water, and I don't give him no sweet drinks at all. I try very hard to try and do some shakes. I would just use a banana, apple, a little water, and make a little shake for him, simple as that, and he likes it. But I try very hard to. But although he has a little size, he is not lazy. He's very active, very, very active.
People think you can look at someone and say they're healthy or not healthy. I'm sure you were shocked when you heard you had high blood pressure.
Yeah, we were.
You know, and like you said, your son may have weight, but he's not lazy. So you can't tell by looking. You just need to know your numbers, as they always say. Tell me about your journey with your daughter.
I think part of it has been sort of inspirational for us as parents. We've been trying to do a better job in terms of managing our own diet, drinking more water. And I think both of us have started committed to start exercising. Like I joined CrossFit, which, yeah.
That's extreme.
Yeah.
That's good. So do you all have set expectations? Like, is there a weight you're trying to hit for the children, for yourself? Do you see this as a life change, or is there an intermediate, like, baseline you're trying to get for them? How do you see it?
I think the pediatrician had made some specific suggestions in terms of the amount of weight that she wanted. She had a target. We've been trying to meet that. But I mean, I think this is something that's ongoing. This is lifelong, really, in terms of just committing to good health.
Yes, I would say it is a life-changing going forward. I just want to prevent him from contracting any diabetes and any problems with his heart, because he's also asthmatic. And even if he does not lose the weight, at least it was still, I didn't expect him to lose the weight right away, but it was help manage in terms of his health, because he does not have any ailments right now, and I don't want him to contract anything like that. So I would try very hard. But he also encouraging me to join the exercise program. Laziness have me can't start yet, but he's pushing me all the time. He's pushing me. And I plan to start just to give him that encouragement further.
All right, for me, for Darren, he's on a lot of medication, steroids, and it tends to put on weight. So I guess this would be more like a lifetime thing. Once he's on the medication, then to try to keep the weight down as much as possible. And also you get a little fitness. So it's a pretty good program.
Have you all seen a change in your self-esteem?
His self-esteem? Yeah. Changing clothes too. Yeah, they get a little room in them, so I met a little smaller now. Like, it coming along. I know it would take time, because you don't just drop weight overnight. So it would take time, but consistency, and you could get there.
One last question. What would you say to people who have a child at home who's overweight, but they don't want to send them to the Yute Gym because they think only people who have heart attack or strokes come here?
Well, there are many things you can do as a parent of a child. I always say, first and foremost, you can exercise at home. Go at the beach, wherever, you can take the child. You can work out at home, you can go outdoors. Saying that, should I put this? The age of technology, everybody's sitting at home on a tablet doing whatever. You can take that same tablet, go on YouTube. Lots of exercise programs out there. Just choose a couple with the instructions and start working out. Seriously, start working out.
Well, it is. I would encourage them to try very hard, even if they don't want to join right away. They can come and just witness and see what is going on. It is very encouraging, because when they reach here and the kid reach here, is not only their kids, because they will have other kids who are probably in the same position as them, and that will give them that encouragement. The environment is very comforting. The staff are very nice, they are very helpful and encouraging. And the children, it so happens, they get along well with each other, even the first day, and the parents, they're aware that they can sit down and relax. So it's a very good program. It's very good. I would encourage any parent to make an effort and encourage the children to come out and join the program. Even if they don't want to join, like I said before, they could just come and witness and see for themselves on a Saturday mornings from 8 up to about 10 o'clock.
But I think one of the things I want to encourage people to do is to consider that this is family, and this is a family change, really. And the more people can support each other, then the better for everybody is in terms of health.
If you need more information on NCD management for you or your child, please speak to a healthcare professional in your area to get help in making your health a priority.